This is the dplaqr, or also known as the Perio Aid, depending on which company makes it. The dplaqr is made for cervical line plaque. There are three areas that get a lot of plaque in a patient's mouth. One is the occlusal surfaces, which we clean thoroughly with toothbrushing. The other is the interproximal surfaces, which we clean with dental floss. The cervical third should be cleaned with toothbrushing, but a lot of patients have difficulty with this. Thus, they invented the dplaqr, or also known as the Perio Aid. If you look closely in the center, it'll say insert pick this side, and one side says cheek and the other side says tongue. Take a rounded toothpick, place it where it says insert pick this side in the very fat part, about 1/4 to 1/2 inch. Press it all the way up until you hear the first click. Take the white collar, pull that up, adjust till it's tight. Put your finger on either side and just break off the toothpick. If it doesn't break smoothly, you can just use the base to smooth this out. Go to the opposite side, inserting the same way. Place the toothpick in 1/4 to 1/2 inch. Press till you hear the first click. White collar slides up till it's tight. Break off the end. Then you want to look to see which is the cheek side and which is the tongue side. This is the cheek side. We'll do that first. Grab yourself a fulcrum if possible and go around the tooth, around the cervical line, up and over the contact to clean that cervical or CEJ area. As you use it, you'll notice that the toothpick starts to flare out a little bit. This is good because it becomes like a little toothbrush and gets even more plaque off. Going around and up and over the contact, around and up and over the contacts. All the way around on all the teeth. I'd like to start from my buccals in the posteriors and come up and divide my mouth in quadrants. I just think it's a lot easier for most patients. When I come and do the linguals, you want to switch the sides. Come from the lingual portion, same thing, up and over the contact, up and over the contact. Toothpick kind of broke a little bit there. Up and over, holding it vertically on the anteriors. Starting in the posteriors again, coming forward. When I go to my upper teeth, it's the exact same way. Try to keep a fulcrum up and over the contact. Dividing the mouth in quadrants if possible. Starting from the back and coming forward again. Also on the linguals, it would be the exact same way. Creating that 90-degree angle. The Perio Aid for the dplaqr. Easy breezy.